If you really hate using your CPAP mask, let me first say I hear you and you're not alone. In fact, mask discomfort is the #1 reason people quit using their CPAP machine. But as a sleep doctor, I'm going to be real with you. Quitting could literally cost you your life. Today, I'm sharing the exact framework I use with my patients to turn that dreaded device into a tool for restorative sleep that you can actually look forward to using every single night. Hi, I'm Dr. Cacho, an integrative sleep medicine physician and women's sleep expert. I've spent over a decade helping people just like you overcome sleep struggles and be able to use their CPAP again at night. So let's talk about CPAP discomfort. Can it actually be more comfortable? Yes, 100%. I see this almost every day in my practice. Certainly, if there is a will, there is a way. But it does require a shift in 3 specific areas. Number 1, your why. Number 2, your gear. And number 3, your mindset. When you actually get these 3 things right, you don't just tolerate the air in the mask, you actually look forward to sleeping at night because of how vibrant and wonderful you feel the next morning. Number 1, let's talk about the why, and it's not just about snoring. We often think about obstructive sleep apnea as snoring and something that my bed partner wants me to do so they could get better sleep. But I'm looking at the bigger picture of your overall health and longevity. Specifically, I'm focused on your heart. For my patients who have moderate to severe obstructive sleep apnea, which means that your breathing is disrupted more than 15 times an hour, not treating your obstructive sleep apnea can really cause a lot of havoc. Untreated obstructive sleep apnea can lead to higher rates of high blood pressure, irregular heartbeat, specifically something called atrial fibrillation, and even heart attacks and strokes. My patients realize that it's not just about using this machine for their sleep, but really about being present and around for their families for years to come. It suddenly makes the mask feel a lot lighter. Number 2, we really need to find a perfectly or just comfortably fitting mask. I do hear this every day. Doc, this mask just wasn't made for my face. And you're right, it wasn't. Masks, at least at this time period, are not custom made. However, there are over 200 different styles, and I know we can find something that can work for you. I have a patient, let's call her Michelle, and she's tried over 5 different masks and was ready to throw it away. I totally empathize with her because for my own CPAP journey, it was a struggle to find a comfortable fitting mask. We finally tried one of the really new small nasal pillow masks instead of those really bulky full face ones, and it was a total game changer. She went from 3 hours of use every single night to 8. I'm not joking. She didn't have any more headaches, didn't wake up in the middle of the night to use a restroom, and she finally ditched that afternoon caffeine fix. The third part of the framework is your mindset, and this actually may be the most important thing. What you believe you can achieve, and sometimes the barrier isn't that little piece of silicone or the sound of the mask leaking. It could actually be your brain and the thoughts you have in and around the mask and the machine and your sleep apnea all together. The technique I use is called clinical hypnotherapy, and I can actually train patients to rewire their subconscious views about the mask and their CPAP. Instead of that really suffocating feeling, we can train the brain to see the machine as something that's actually cool and life supporting. Once that switch flips, the physical discomfort often doesn't feel as heavy. Ladies, I know it feels so unnatural to have air blowing in your face at 2 and 3 a.m. Totally unnatural. But you know what else is unnatural? Feeling exhausted, fatigued every single day of your life. Please don't give up on yourself. If it feels like your current setup isn't working for you, it doesn't mean it's time to quit. I hope you can find a really good sleep physician in your area. You can check out the American Academy of Sleep Medicine to see if there's a board-certified sleep clinic in your area and someone that can really listen to you and help. There is a solution out there. If you want to dive deeper into further topics about women's sleep health and whole living, please join our Sleephoria Sisterhood. It's a free community over on School. Until next time, ladies, sleep well. Thanks for watching.